Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Welcome to our podcast series on cardiac rehabilitation, where we're going to take a closer look at the nurse's integral role in heart recovery. I'm Dr. Candace Pierce with Elite Learning by Calibri Healthcare, and you are listening to our Elite Learning podcast, where we share the most up-to-date education for healthcare professionals. Now, according to the American Heart Association, nearly 800,000 Americans suffer a heart attack each year. And what we do know is that we as nurses play a crucial role in helping these patients get back on their feet. So in this episode, we're going to focus on the heart of recovery, really looking at a nurse's experience and their challenges in this area. And we'll look at what we can do to support patients recovering from cardiac events. So one of the other things I hope we will be able to highlight is how rewarding this area is and how critical this work is. So joining me for this insightful and inspiring discussion is Erin Hill. Erin, thank you for taking time to join me for this series.
Yes, thanks, Candace. I'm so excited for this opportunity.
Absolutely. I really kind of want you to start with your background. How did you get started in cardiac rehabilitation?
Yeah, sure. So honestly, my passion for cardiac everything related and cardiology started back in high school. I did a lot of reports on heart disease and did a lot of different things with my anatomy classes. Got into nursing actually through studying exercise science. I started with that in college, switched to nursing, still had this passion for cardiac related things. Ended up working right out of school on, medical surgical unit. Got into case management after that. And then I was so fortunate and blessed to get hired on as a cardiac rehab nurse. It was a part-time position. But yeah, it was honestly, I was just very fortunate to have that. I've worked in 3 different rehabs. So, I've worked in a program in Ohio. I've worked in 2 here where I'm living in Atlanta.
Mhm.
Um, and honestly, I'm so thankful for the job, for the ability to work in cardiac rehab, and the patient population is just amazing to work with.
Can you share a little bit about your experience working with the patients who are recovering from these different cardiac events?
Yeah, absolutely. So, those who have had some sort of heart event are eligible to participate in cardiac rehab. So, any post-MI patients, post-PCI, post-CABG, if they've had a valve repair, replacement, heart failure patients, we get a lot of those, unfortunately. And then also, too, if they've had a heart transplant, they are eligible to participate in cardiac rehab. And cardiac rehab takes place, it's usually about a 3-day-a-week program. So it's outpatient. We're ambulatory. They're coming to us 3 days a week, Monday, Wednesday, Friday. And we have several sessions throughout the day where they're coming in. The sessions are about an hour long, and during that hour time frame, we have them, on telemetry. We're checking their blood pressure. If they're diabetic, we're checking their blood sugars, and then they're doing about 30 to 40 minutes of aerobic type exercise, so treadmills and bikes and ellipticals and those types of equipment. And then also too, with the facility that I currently work in, that we have a lot of resistance training equipment too that we can utilize with them. Um, so that's kind of the gist of what cardiac rehab is. And we also too, we have a medical director that oversees the programs. We're working closely with him too.
What do you think sets the cardiac rehab apart as far as nursing?
Um, Nurses, I feel like, I work on a multidisciplinary team. So my coworkers are exercise specialists, dietitians, and respiratory therapists. As far as nursing goes, we definitely have more expertise with like the medical side of things, the medications. all their different comorbidities, and managing those things, giving them education on all of those things too. And also, I feel like we're better equipped to communicate with their physicians or their medical providers whenever there's an untoward event, or whenever, just any communication updates. And then I believe too, I mean, there's a lot as far as policies, procedures, keeping those things updated. And that's where a lot of the nursing expertise and experience comes in, to, I guess, participate in that as well. So that's kinda, yeah, where the nurse comes in. And there's definitely more like a case management too aspect of it. So it's not just, you're seeing these patients 3 days a week, but we're connecting with them at home too, making sure that they're continuing their exercise or communicating. A lot of our patients too go to dialysis, so communicating with them and those doctors, and it's a lot. We wear a lot of hats in cardiac rehab
Yes,
for
that's what
sure.
I was thinking.
Yeah.
Oh, and while you were kind of describing all of that, what I saw, or what I was thinking about was you're really describing this like relationship. You're building this relationship with your patients.
Mhm.
You're really getting to know them more than you
Yeah.
would say, in a med surge unit or in those types of roles. So, what do you see are some of the biggest challenges that you have in this role?
Unfortunately, there's quite a few. A lot of cardiac rehab programs are very small as far as physical space goes. Just, we're not big money makers. We're
Yeah.
not the cath lab or the OR. So, unfortunately, a lot of hospital administrators and, they don't value what we do. So the space is small, and that means, not as many staff. And then that unfortunately affects the patient, where it takes longer for them to enroll in cardiac rehab after, their heart event. We try to get them in within 2 weeks after their discharge, but sometimes it can take up to 2 months, unfortunately, just 'cause the demand for cardiac rehab is so high, and there's not many programs, there's not enough space for them. And also too, I think most medical professionals have difficulty with time for educating the patients too. That's
Mhm.
definitely a challenge as far as educating the patient on their diagnoses. A lot of them don't have any idea. They understand they had a heart attack in the hospital. They don't know quite exactly what that means, or, all these lifestyle changes that need to take place afterwards. They think it was just a one-time thing, and, they'll do the rehab
Mhm.
and be done with it, but it's something they don't fully understand, that it's something they'll have to make these changes every day for the rest of their lives. And also too, another challenge is financial. Medicare and all these other insurance companies, they cover cardiac rehab, but unfortunately, they also charge a copay, just like you're going to the doctor's office. So that can definitely be a barrier, because it's a copay every session that the patient attends. And then too, transportation, a lot of the patients rely on that. So that can be a barrier. Chronic pain, we see that a lot too with patients. And unfortunately, a lot of people will, discharge themselves from the program just because they aren't able to exercise with all their pain, and, um, not getting quite enough support from the doctors as well. Some doctors are really pro cardiac rehab. Some of them are, they don't refer their patients to us. So that can be discouraging as well. And then too, I think the last challenge is, a lot of our patients, and I'll touch on this later too, a lot of them struggle with psychosocial needs. Patients are more likely to have anxiety and depression after a heart event, and that can go unaddressed by the doctors. The patients don't really, understand what's going on. They know that they feel more anxious or more sad, and it's affecting their day-to-day life, but they don't, understand it was
Mhm.
probably a result of their heart event. So they're not getting enough support with that, and their attendance with cardiac rehab will suffer from that.
So it's there's a high need, so high need but low reimbursement.
Yeah,
So
correct.
And I'm assuming maybe like in your area, there's not a lot of options for patients to go
Mhm.
for cardiac
Mhm.
rehab.
Yeah, yeah, that's correct. Honestly, every single hospital system should have a cardiac rehab, but not all of them do. Cardiac rehab has to be a hospital-based program with due to reimbursement. But it's yeah. And especially too, if someone lives, if they're more rural rather than in the
Mhm.
city, they're gonna live further away from a hospital and they're gonna be less likely to participate as a result.
I just wonder why it's such a low reimbursement rate and why it's
Mhm.
not utilized as much
Yeah.
as it should be, because I know the research is there that shows the
Mhm.
need for this type of program. And
Mhm.
then for physicians not to refer the patients to cardiac
Yeah.
rehab, that I have a hard time wrapping my head around that when the research
Yeah.
really does show how important it is.
Mhm.
What do you think that barrier is as to why some physicians don't necessarily pursue cardiac rehab for their patients?
Yeah. I don't know, it could possibly be because they don't fully understand what we do, and also, they don't see the value of it, and a lot of times too, they'll have patients who are we see patients who are younger, 30s, 40s, 50s
Mhm.
with heart events, and maybe they were physically active before their event too. So the patient will just be like, "Oh yeah, I've been exercising since my event. I feel fine," all these things. So the doctor will be like, "Okay, just keep doing what you're doing." And we won't get a referral from that. So it
Mhm.
really is dependent. We do have good support from a lot of the doctors, but there are some it doesn't make sense. Or, the patient after maybe they've attended 3 or 4 sessions and then they're like, "Okay, cardiac rehab is I don't feel like I'm benefiting from it, especially because 'cause I'm already doing things at home." And they'll tell their doctors that, and the doctors will be like, "Yeah, that's fine, just, you don't have to attend if you don't want to." So, that's kinda yeah, it's unfortunate, really, but yeah.
How do you manage the emotional toll of working with some of these patients? Because I mean, they're really ill.
I know, yeah, that is, and that can be challenging too. It's hard because when they first come to us, we do like an initial assessment, like an initial orientation type day with them where we talk about every aspect of their health. And of course, we address psychosocial. We use a screening tool called the PHQ-9 Patient Health Questionnaire. It's got 9 questions on it. That's what we use to screen for depression. There are several other tools out there, but we address that with them and we talk through, their history as far as anxiety, depression goes. We talk about their current stress levels. How has, work been? How are they sleeping at night? We're addressing all those things. And that can definitely be challenging too, because sometimes you get, yeah, people who they really open up to you, especially
Mhm.
on that first day. You build that trust with them and that it can be challenging because you're like, for the nurse, it's like I can put myself in their shoes, try my best to do that, and really try to value them, listen to them. Um, but it's really just I guess giving them that encouragement that first day that things, it will get better. And what's nice to see is when we do that initial screening for depression, we reassess them usually about after the first 30 days in the rehab program. We will almost always, I would say 90% of the patients, 95% will see an improvement in that depression screening. And then definitely by the end, by the time they've done, 24, 36 sessions with us, we almost always will see an improvement in that score, and that's just so amazing to see, and we go over that with them, and we're like, "Look at how much, you've improved in this area," and we ask them, "How are you feeling? How has this affected your day-to-day activities? How has it affected your sleep?" So, I think it's just that's a very rewarding, piece of the of the cardiac rehab work that I do as well, seeing that with patients improve, but honestly too, with handling those patients and working with them, it's taking care of yourself too as a nurse, making sure you're prioritizing your own health and sleep and nutrition, exercise, those things.
How often do you get patients that come in or who you can tell they just don't believe this is gonna work for them?
We actually I would say, not quite half, but maybe 30-40% of patients, they're very skeptical. They'll come in and like I mentioned earlier, it's mostly the patients who are already, making lifestyle changes. They've changed a lot of their eating habits after their cardiac event, and they've, improved their stress. They're starting to exercise again, or maybe they were already exercising too before their event. So they're just like, "I'm not sure how cardiac rehab is going to really change things or really help me too."
Mhm.
And honestly, that can be challenging because it's like, yeah, that may be true, and, I may not be able to convince them of the benefits, but I can definitely still educate them on the research and all the benefits and, let them make that decision on their own too and give them the tools they need maybe to just, yeah, continue at home, at least giving them some guidance as far as exercise and intensity and things so that they continue at home, but
Is there a role for family members in cardiac rehab?
oh, absolutely, yeah. A lot of times, the patients will bring their family members at least to that initial assessment that we do with them, um, and I think too, just a lot of the patients will struggle, with making all these changes as well
Mhm.
with their exercise and their eating. And so educating them, it's helpful when the family is there too, going over all that information with them because then the family member can see, oh, yeah, maybe, I can make some changes with myself too to support my loved one who had this event. So also to the family members on occasion, will attend the session with the patient. They can't do any exercise with the patient, but they can at least be present in the room and see what their loved one is doing and how they're feeling and how much improvement they're making too. So that can help with the family member as well to, I guess, spur them on to
Right.
supporting the patient and change. And yeah.
So I don't have experience in cardiac rehab, but I
Hmm.
started my nursing journey on a cardiac floor, sending them to have open heart surgery and then taking care of them when they were done. And so I have experience on the prior to them coming to
Yes.
see you.
Hmm.
Um, but as I'm listening to you, kind of what I want you to correct me if I'm wrong, but part of what I am understanding is it's really bringing them in to continue that education that was started in the hospital, but to also work towards helping them create healthy routines
Yes.
to continue to improve their health and maintain their health.
Mhm. Yeah, yeah, absolutely. Um, and honestly, I think the best things that on the inpatient side that the nurse can do, would be to discuss, exercise. Exercise, even walking at home is perfectly safe after a
Mhm.
heart event. So giving the patient that sort of education. And there are so many different, medications and things that these patients are started on that they're not used to, that they have no idea how
Yes.
to take them. And I see that a lot, unfortunately, when the patients come to us. They're on 2 or 3 different new blood pressure medications. They're on a statin, they're on blood thinners. So educating them on the importance of those medications, taking them, that's honestly the best way that they can be supported, from the inpatient side. But to
So, oh, go ahead.
I was just gonna say, I think I just giving them, yeah, that education about home walking on discharge, giving them education about quitting smoking and that sort of support as well, because we see that a lot too. That's, yeah, best way to support them.
So it sounds like they're with you for a while. So when do you really start to see that the education and the routine is really starting to take hold for that patient?
That's a great question. I would say honestly, after the first at least 12 sessions, you can just see the patient feels so much better, so much more confident with their exercise too. And they know what a normal blood pressure range is now. If they're diabetic, they know what a normal blood sugar range is. But yeah, we have them up to 36 sessions. That's what Medicare will pay for. So it's so cool to develop that relationship with them and see them over time. um, rebuilding their confidence, with their exercise and giving them that education too. It's so rewarding, but yeah, I would say overall that first at least 12 sessions, you can tell there's just the emotional and yeah, even their physical abilities too, being able to see them progress in their exercise. And they're just yeah, it's just amazing to see. And usually too, we're group sessions, so there's 5, 6, 7 other patients in the session with them too. And a lot of them too will build relationships with other patients. It's really neat to see that as well.
So throughout this, I've heard you say often it's so rewarding. So if
Mhm.
you had a nurse that was listening to this and thinking, I've really been thinking about pursuing cardiac rehab, what is this? So what would you list like the most rewarding aspects of being a nurse in cardiac rehab? What would that list look like for you?
Yeah, well, like I mentioned, definitely that seeing that long-term relationship with them, and it's not even just focusing on their health too, but getting to know them as an individual and as a person and valuing them. So asking them, I like to ask people, Did you do anything fun over the weekend?" Or,
Mhm.
"How's your family doing? Did you grow up around this area?" Those sorts of questions too helps build relationships, and like I mentioned too, just seeing them rebuild their confidence after their event, and being able to just sit one-on-one, and with the inpatient side, it's hard to, I guess, have that time to sit one-on-one with a patient and really talk with them, so that's another thing that's so rewarding with them too, and actually having that ability to give them education. With my role as well, we have a couple different, governing bodies. So the American College of Sports Medicine gives us a lot of our, like, regulations and things, and we also have the American Association of Cardiovascular and Pulmonary Rehabilitation. So those 2 organizations, they hold state conferences, national conferences as well. So that can be rewarding too, to be able to attend those, and to, collaborate with other professionals in the field who live, all across the country. That's really neat as well, and get different ideas on how they operate their rehab programs. And also too, the American Association for Cardiovascular and Pulmonary Rehabilitation, they do a program certification, which is very rigorous. There's a lot of statistics on patient performance measures that need to be
Mhm.
gathered, and making sure policies and procedures are up to date, doing emergency in services, and continuing education. So working on that as well and accomplishing that is so rewarding, so fulfilling to say that, my rehab program is a certified program. And then too, um, we get to work with cardiologists in all different specialties, heart failure cardiologists, structural, interventional, transplant. So that's really neat too, to be able to work with that multidisciplinary team as well. And just, continuing to learn for myself as a nurse is very, yeah, rewarding.
So, can you share like maybe a memorable success story from your work?
Absolutely, yeah. And it's actually neat. This particular patient had a heart transplant. Oh my gosh, and he was just so inspiring. I had the privilege of doing his initial assessment, and he would just tell me all the time how, just so thankful he was to have a heart transplant. Those people are very sick, obviously, with heart
Mm.
failure before that takes place. And I remember after post-op, after his transplant, he was telling me he'd get up and walk the hallways around the nurses' station. He would even go into other patients' rooms and try to get them up and walking, and get them out of bed. It was just so neat, and he stayed with us the full 36 sessions, and just being able to see him progress in his exercise, um, and our communications department actually did a story on him too, on his progress and his surgery and post-op everything. So that honestly, I'm so proud of that. Even
He
to be able to talk
sounds
about that. Yeah.
he sounds like maybe he's a volunteer now
Yeah,
at your cardiac
exactly.
rehab. Like he's still coming around
Yeah.
and
Yeah.
trying to
He
help
is,
others.
yeah, absolutely. Because where I work, my facility, we are connected to we call it the wellness center, but it's a gym, where patients can come to as well, and anybody, honestly, from the community can
Mm.
participate. So he will come in, yeah, and says hi to us every time. It's so neat even to see him now. I mean, it's been over a year since he was with us, so it's just, oh, it's so cool to see him.
Well, now I want to know if you have another success story. That's a fun story.
I know, yeah. Yeah, honestly, it's because we're a part of the wellness center, our rehab's right next door. I mean, I see patients all the time, after they're done in our program, and it's just so cool to see them still active and still being, a part of their exercise program. It's just, yeah, it's so neat to see that.
So it sounds like that a lot of them, when they're done with their time with you, they still come to the gym. So you still get to
Yes.
kind of maintain that relationship with them,
Mhm,
still get
mhm.
to check on them, answer any questions that they have.
Yeah, yeah, absolutely. Because sometimes they do, and even, after their discharge, I give them our business card, I put my email on it and tell them, "Feel free to reach out anytime with questions, email me, call me," So
Yeah.
it is, yeah, we're still definitely very much involved, with them after their discharge from us.
That's really good to
Yeah.
see the familiar faces. You've
Mhm.
created that trust with them. They know where they can go if they have questions. So I love how even though they transition out, they still have access to somebody, and you're probably easier to get to than their nurse at their versus their physician's office, honestly.
Yes, yeah. Oh, it's so true, yeah. Some people, yeah, they have if they have difficulty reaching their doctor's office, so they'll come to us and ask
Yeah,
whatever questions, yeah. Mhm.
that's really good.
Mhm.
Well, we are out of time for this first episode. Erin, thank you so much for taking time to
Yes.
really just share your insight into cardiac rehab and what it really looks like. And just it's amazing to hear firsthand accounts and challenges that you have with patients and how you can work through those and just how rewarding this area is because it's not a highly talked about area of nursing.
Mhm. Mhm.
Is it
Yes, thank you so
hard?
much.
Is
Yeah.
it hard to find an opening in cardiac rehab?
Sometimes it can be, there's a lot of programs that are always looking for nurses, so it depends. Definitely full-time positions are difficult, but
Yes,
PRN, part-time, yeah, for sure. Yeah.
absolutely. To our listeners, I hope you found these stories and insights as inspiring as I did. Erin, you're amazing. I love hearing your passion for your patients. So,
Thank you,
um,
Candace.
yes, our next episode, we're going to focus on effective patient care strategies and best practices.
All right.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.